Okay, this is James. He has volunteered to be my patient today. We're going to do his nose, mouth, and throat exam. This is part 2 of the assessments for module 4.1. He really doesn't have any changes or concerns. We're just doing a well exam on him. First, we're going to look at the camera, please. And we're going to look at his external and nasal structures. We're going to notice that his nose is symmetrical, and it is midline, and it is proportionate to other facial features. It has no deformity or inflammation, no skin lesions, non-tender with palpation, and I will be using an otoscope for inspection. We are going to check the patency of the nares. Okay, just a second. Right there. Okay. And let's see. I'm going to improvise a nasal speculum, but if I had a nasal speculum, it would actually spread the nares where I could look up inside of his nose, but I'm going to use this to actually look inside. And I'm going to look for his vestibule, and I'm going to look for the turbinates, the middle and upper turbinates. And he has no rhinitis. Middle inferior turbinates. And the septum is without deviation or any polyps. When I palpate his frontal sinuses, they are non-tender. And the maxillary sinuses are non-tender when they're palpated across the cheekbones, and firm pressure is used. He reports no pain. His lips are non-cracked, pink, moist. They're not dry. I don't have any lesions. Let's see. And then the mucosa. I'm trying to see if you're getting. Okay. The mucosa is pink and moist, and it's non-tender. He is without any teeth or dentures. And I'm going to improvise a retractor. It's pink and moist. And no gum, or his gums are also pink and moist, and they are without. Open your mouth, big much. Without. Let me get a flashlight. Without any lesions. Sorry. His buccal mucosa is also pink and moist without any lesions. The hard palate. Tilt your head back. I know it's hard to get, but inspect the hard palate. And notice that it is like a pinkish white in color. With irregular transverse rugae. Oh, baby. Posterior palate is smooth and pink, and it is inwardly movable. He has a bony ridge that is along his mid-plate. See his uvula. Stick your tongue out. I'm going to be easy. I know you got a bad gag reflex here. Stick your tongue way out. Say ah. Oh God! Please don't. Anyway, his uvula is there, and he has a superimposed gag reflex. And we know that his cranial nerve and his vagus nerve are highly intact. I'm gonna also. Can you do it? Can you open your mouth? Can you say ah? You can also. Let me see if I can just look in there without poking around. You can also see his tonsillar ridges there, and they are like a peppery-like color. They're not swollen. They are they +1 because they're visible, and halfway between the tonsillar pillows and the uvula, so that makes them a +2 there. Okay. He has no halitosis. You can put your tongue back in your mouth. He has no halitosis or food debris. His tongue does protrude midline. And he doesn't. Let's see. There's no drooping. Let's see if there's anything else that I missed. Oh. And also, I won't use the tongs, but anyway, I was supposed to use like a washcloth to grab his tongue to move it to the side, but I'm afraid I'm gonna make him sick. So you just stick your tongue out and he can just move that to the side. I would grab a hold of it with the washcloth, move it to the side, and I would look at the floor of his mouth. Let's see, what else do we do? Let's see. Oh, and you can also see the retropharyngeal wall at the back of his throat whenever I ask him to open it up and say ah. Ah. Okay. And it's there's no redness or anything. It's pink and it's moist. Let's see. And I think that concludes the nose, mouth, and throat assessment for James. And we appreciate you being a sport. And for not getting sick.